Hi, everyone. Welcome to After the Diagnosis, a webinar series presented by the Neuroscience Family Advisory Council here at Boston Children's Hospital. In this webinar series, we'll be talking to caregivers and providers about diagnoses that we face and giving a completely different perspective on them. Today in this episode, we're going to be discussing cerebral palsy and spasticity. We have two different participants, each with a different background, and we're super excited to get started. So to start our introductions, I'll go ahead. My name is Dylan. I am a clinical research assistant in the Department of Neurosurgery and a co-chair of Neuroscience Family Advisory Council. I was a former patient, and I've now come to work at Children's to help kids just like me. So first, I'll turn it to Dr. Northam. Dr. Northam, what was kind of the path to where you are now, and how did you find yourself kind of at this really interesting niche of surgical, the neurosurgical management of spasticity?
Well, thanks, Dylan. Thanks for having us.
Yeah.
Yeah, I was lucky enough to finish my neurosurgical training by coming here to Boston Children's. Um, and this was several years ago for the fellowship program that they have here, which was really a tremendous experience. And then I was lucky enough to stay on afterwards as one of the, staff neurosurgeons. And one of the things that I've been interested in for a while since I did my neurosurgery training was what we call functional neurosurgery, which means how do we use surgery to try to improve the way that the nervous system works. And often people think about deep brain stimulation, but that also extends to a lot of other treatments that we offer. And one of the regions of medicine that we really needed to be able to expand was in our treatment of cerebral palsy and a lot of the problems that kids with CP can have. And so that became one of the biggest areas of my practice.
Wonderful. Kristin, how about you? What was your path to where you are now? How did you kind of find yourself interested in this, niche subspecialty as well?
So when I graduated nursing school, the first job I could get in pediatrics was in a rehab center that treated patients that were premature, growing on vents, or
Yeah.
had very complex medical issues. And my practice really grew from there. I grew to love the population. The opportunity came up at Boston Children's to do manage the Baclofen pump program and really get specialized in tone management. So I was able to take my love of these patients that have multiple complex medical issues and cerebral palsy and really focus it and become more of an expert in the realm of Baclofen pumps and tone management.
Fantastic. So let's get into some of the questions. So I'm lucky enough to be one of the research assistants for the STOMP program. So I get to hang out with you guys every few weeks. I love STOMP because I think it's fascinating that there are, so many different providers all seeing patients at the same time. So first and foremost, Dr. Northam, tell me about the Cerebral Palsy and Spasticity Center. What do you treat? Kind of why come to us for treatment?
Sure thing. So I would say our strength in general when it comes to CP is that we have a big depth of expertise. And what that means for me is that I have a lot of super smart people that I work with, including Kristin, who's here, including lots of other members of our team that each have a wealth of experience in their own right. But I think what we do is really come together as a group to see these patients at the same time. And that allows, the families to maybe come a little bit less to the hospital because they're seeing more people at once.
Mm-hmm.
But it also allows us to spend time with each other as providers and also with the family talking together about what's going to be the best treatment option for their child. And I think that's one of our strengths is just we have a very large CP clinic. We have a lot of experiencing a large number different kinds of patients with CP, and we try to be as creative and focus on an individual family as we can to try to get them the best functional outcome.
Fantastic. Kristin, anything to add there?
I think that as a nurse, I bring a slightly different perspective into the what the family is actually experiencing and ensuring that they're able to care for their child and everything else going on in their lives. So I feel like I bring that to the table too and make sure that the team is thinking of that also.
Absolutely. So let's talk about CP itself. Dr. Northam, if you could tell me kind of what is it? I mean, we hear this kind of overarching term, and I've gotten to kind of understand the difference between spasticity and dystonia. Tell me about CP as a whole. How is a child diagnosed? Is it something that they're born with? Is it something that can be developed? Walk me through that.
Yeah, that's a good question. I would say our understanding of what causes CP is always evolving, but we've known what CP is for a long time, which is that it's change that happens to the brain early in life, usually around the time when a baby's being born, or sometimes even before or right after. And what tends to happen is a part of the brain or several parts of the brain are damaged and don't work correctly, and that damage is the same throughout life. In other words, that damage that happens doesn't necessarily worsen or change. We use the word static to describe that, which just means that it's not changing. But of course, a person can change and evolve and become different over time, but that actual damage that happens is the same. And that's one of the hallmarks of cerebral palsy. But as we've studied it and as we've, done more testing and learned a lot more, what we now know is that there's a lot more to the picture than we initially thought, and up to 1/3 of patients with CP actually have a genetic diagnosis. And so we used to think that all kids with CP, for instance, didn't get enough oxygen around the time they were being born, as one example. But now we know that there's so much more of the picture of different kinds of conditions that can affect the way that the brain works earlier in life. And that actually, our eyes have been opened a lot to how many different genetic conditions are responsible too. So we were talking about our CP team, and one of the things that's great about that is we have a geneticist that's really excellent named Sid as well. And so as we're learning more about these patients, we're learning more about the genetic conditions that can underlie a lot of CP too.
Kristin, tell me more about kind of the symptoms that I know there's a range, right? There's a CP is kind of the overarching term, and there's a range of how patients present. But kind of tell me about what a parent would be looking for, what they would see in a child with CP.
So a lot of times parents notice that their child isn't developing on the same track as their like other children developed before them.
Sure.
Sometimes the patients have a little bit more difficulty moving their legs or their arms. Sometimes patients have a little bit more difficulty producing speech. And sometimes the patients just have a little bit of an intellectual disability as well. So they have a little more trouble interacting with their environment and understanding what's going on.
Yeah. Okay. So then let's talk about treatment options. And from what I understand, you can correct me if I'm wrong. It sounds like treatment is kind of it's a longitudinal process, right? Like from what I understand, we start with non-surgical treatment, and eventually if that doesn't kind of treat the symptoms, then we involve Dr. Northam. So Kristin, tell me, more about the non-surgical treatment to CP. What does that look like from your perspective?
So that's involving a multiple collection of specialists to address all the issues that the patient is having. So the patient might be involved with the orthopedic surgeon, the rehab doctor, physiatrist. They might have a neurologist involved. They might have a complex medicine doctor involved to help with the other medical issues. And sometimes these patients have other medical issues that they're also addressing at the same time. Often GI is involved as well. And when they come to CP clinic, we're going to be looking at all of these things, including the nutrition. There's a nutritionist there as well. And making sure that we're able to maximize the patient's potential and development.
So then if that kind of fails to adequately address the spasticity, that's when we come to Dr. Northam for surgical treatment, correct?
The physiatrist will use some medication sometimes at first if the
Yep.
tone management isn't as good. So if their legs are really tight and that they try the medication, it might not
Yep.
work as well for some patients. Sometimes the physiatrist will do targeted injections like Botox and phenol
Yep.
that can help relax the muscles locally. Oftentimes that doesn't it works really well at first, and after a long time of doing it a number of times, it doesn't work as well after a while. And that's when we turn to Dr. Northam to look at surgical options for tone management.
Which is a perfect segue. So, Dr. Northam, from what I understand, there is kind of two paths to surgical treatment. There is a Baclofen pump, which is the drug that Kristin is talking about that kind of continuously infuses. And there's also what we call dorsal rhizotomy. So I'd love if you could expand kind of on these two different treatment options. And then we'll kind of hone in on dorsal rhizotomy because I know that's something that we've been working on a lot over at Children's. But yeah, first tell me about kind of these two different treatment pathways.
Okay, yeah, no problem. So I would say that in general, we talked about CP. CP is the most common cause of disability in children, and that means that these changes to the brain that we mentioned downstream, they affect the muscles, they affect the arms and legs, and can impair the ability of a child to move and to walk. And so the way that impairment is for different kids is not always the same, but it often involves tightness. And
Sure.
that's a problem that Kristen and I deal with a lot in clinic when we see these patients, both on the arms and the legs, but depending on differences between patient to patient, a lot of tightness and tone. And that comes in two flavors, like you mentioned, which is spasticity and dystonia. Those are two just different types of tightness. And depending on what type of tightness someone has, we try to tailor our approaches to target that to be able to give them the best function possible. And Baclofen pump is one way we can actually provide the medicine that helps relax that tightness into the nerves that need it. That's something that we will use in certain situations. And then rhizotomy is a permanent surgery that we use to actually make small cuts on parts of the nerves that are carrying bad tone signals so that we can reduce that and hopefully allow someone to be more comfortable or to walk better in different situations. So there are different treatment strategies that might work a lot better in different patients.
Tell me more about the rhizotomy. Kind of curious to hear about which patients may benefit more from it, and kind of, certainly after treatment and beyond, what does that follow-up look like? And are there certain protocols that we should be following after treatment?
So rhizotomy essentially comes in two different forms, and one of those is called an SDR, or selective dorsal rhizotomy. That's a surgery that's been done for several decades to actually take patients who are walking, but not walking very well
Mm-hmm.
because of their tightness, and relax some of that tightness to allow them to walk better. So that's really the goal of SDR for the walking patient population. But we also try to use a different form of rhizotomy for some patients who are not able to walk because their tone is so severe.
Mm-hmm.
And that's a situation where we're not trying to necessarily make someone walk, but we're trying to improve their quality of life and their
Sure.
comfort, and their range of motion. And so those are the two different scenarios where we will offer rhizotomy, and they're used in different ways. In terms of the follow-up, we really try to maintain a pretty close relationship with our patients and families after they have surgery so that we can ensure that they're doing well, not just right after surgery, but years later as well.
Yeah. And Kristin, going back to the Baclofen pump, that's something that you kind of follow longitudinally. Am I right?
Yeah, that's correct. So the Baclofen pump is an implanted device that carries drug, Baclofen specifically, and it delivers the Baclofen into the spine where it needs to work right on the nerves. So the device is inside the body, but needs to be refilled with medication every so often. So I follow these patients pretty much for the until they become adults
Yeah.
because they'll have the pump for pretty much their whole life.
And that's got to be so nice for patients and families to kind of have one person that they know to look to, right? When if they have questions about the pump or if something doesn't feel right, I think, that one person to go ask is so nice to have.
It's really nice, and I get to know the patients really well. And honestly, they get to know me pretty well too, because I'm overshare sometimes. But we have a good time.
That's right. Dr. Northam, after the rhizotomy, what should parents expect? Like, should they expect, as we talked about this quality of life, should they expect their child to be comfortable, more comfortable pretty quickly? Or what does that look like? Is there rehab involved?
It's a good question. Rhizotomy is a really big change all at once. And
Yeah.
we're talking about someone who, in a lot of situations has had a lot of tightness in their legs that they've had since they were very young. And then all of a sudden, very dramatically after surgery, after the period of several hours, that tightness is very different and much looser. And so it can feel very different at first. And for patients who are walking, it can actually require a period of intensive rehab, which we call like a boot camp, where really build up strength to take advantage of that surgery. And in patients who are not able to walk, it's still a big change for those patients and families. And we hope, that that's in a positive way. We really want to offer it to patients where we can give them a lot of benefit from having more flexibility and comfort.
Yeah.
But it can still take time to adjust to that and to learn how to use that new looseness to their advantage.
Great. So switching gears a little bit, Dr. Northam, I'm going to ask you first, and then Kristin, I also want to hear your thoughts. What is some research innovation going on at the hospital in the CP world that is exciting you? And I'll give this one to Dr. Northam first.
Yeah, I think that what's exciting to me is that we're beginning to offer more treatment options than we used to in the past for
Yeah.
patients who have a lot of tone and are having a lot of discomfort and pain from that. And so I think for us, that gives us the ability to tailor our treatment to
Yeah.
not just have a blanket approach, but to say, specifically what are your goals and what can we do to achieve those goals? Not just to give you the same surgery, but how can we modify our surgery to make it work for you specifically, not just for us, if that makes
Right.
sense.
Right. Kristin, any research innovation that you're excited about that's coming up?
I am thrilled to be involved with the Stomp Clinic and see such great progress that these patients are having after their rhizotomy surgeries. I think that what we're doing to evaluate what the patient is doing after surgery and how they've recovered and how they're feeling is going to make a big difference in the world of CP in improving these patients' lives.
Yeah. Kristin, are there any patient advocacy groups that you would recommend if a child is first diagnosed? Anybody that a parent should reach out to if they have questions that outside of their normal scope of clinical care?
You mean outside of Boston Children's?
Yeah.
So I know that the Cerebral Palsy Foundation does have some great parent support groups and has a lot of information on their website, as does the CP Research Network and the American Academy of CP and Developmental Medicine has a lot of information on their site as well. I think the CP Foundation does a lot more with families specifically.
Yeah. That's fantastic. Okay, so last thing, and this is kind of your ability, your opportunity to wrap everything up. If you were to tell a parent or a patient one thing about CP or spasticity, and kind of what we do here at Boston Children's, what would it be? You could sit with that for a second, but I'm gonna ask Dr. Northam that first.
Yeah, I would say, talking to families that have CP or new diagnosis of CP, I would say that the biggest thing to know is that although the symptoms and the um, problems that can come from CP change over time.
Sure.
I think being able to understand the cause of the CP is still going to be like the foundational thing that gives us our ability to know how to treat someone.
Yeah.
And we're getting better and better at that all the time. I think we have such a good group of people here that we're able to offer treatments depending on whatever cause of CP, we find. But I think as our ability to understand how CP happens gets more and more refined, we're going to be able to treat patients better too.
Wonderful. Kristin, one thing you would tell a parent or a patient?
I would tell a parent with a newly diagnosed child with CP that their world is about to change and not in a bad way. I think that we need to remind families to look for the good in everything. All of these patients are happy and smiling when they come to clinic. Even if I'm sticking a needle in their pump, we're having a good time. It's a different life than what they maybe planned for,
Yeah,
but I think that all of these families have found some richness in their lives just because their child has CP and the community that they've discovered along with that.
absolutely. And they get to hang out with you guys, which
Of
is,
course.
that's a highlight. Well, thank you both for such a fantastic conversation. I learned a lot. I had a great time. For our viewers, please be sure to head to the Neuroscience Family Advisory Council's website, which will be linked below for more resources and information. And please stay tuned as we continue to announce more after the diagnosis episodes on more and more neuroscience topics.